You know, in the beginning, they said, Robert Johnson Health Policy Fellowship, we want our mid-career academic doctor. And that was really something that people on the Hill prized so much. It was really important how many papers they had written, that they were really true academics.
When I was being interviewed for the fellowship program, there was a very clear bias that this was an academic medicine program.
At the start, it typically, they mostly were white men, and very occasionally a woman as well.
When I was a fellow, we only had one woman in my group. And now it's much more balanced, and I think that's very important.
They had what we used to laugh at, called the token somebody else. Usually that token somebody else was a nurse. My background is I was one of the first family nurse practitioners in the country. I was trained in 1972. Even though I was a nurse by original training, I had become a researcher, and I had also added management skills on my resume. But there was also a nurse who was a very smart and capable nurse who was the dean at Columbia School of Nursing. And there was a rift, I heard about it later, about instead of having one token nurse, they had two. We focused, as the country did, on inpatient medicine in the academic setting, being the sort of gold standard in the way that we viewed the hierarchy in medicine, to a much broader view of health and healthcare. And you could see that reflected in the admissions to the program over the decades.
After the first few years, the people who were nominated for the program were different. They weren't all mid-career academics. And, that also took some education, because the people on the Hill, the senators and congressmen who hired them, took great pride in having a doctor or nurse on their staff, and they were less sure about someone who wasn't a physician or wasn't a nurse. And so, that was kind of a learning curve, which I think worked very well.
When the program started, when it was just a lot of physician clinicians, the foundation in the program realized, well, we're missing some perspectives, we're missing some input, because healthcare works as a team. There's a lot of people involved in healthcare. The healthcare arena works as a team. Nobody does it by themselves. So it made sense that they would start to include, make sure it was interprofessional.
Diversity became a hallmark of the program. There was a very conscious and concerted effort to have every nook and cranny represented, to come and deal with the very tough issues that we're dealing with, including today at the federal level.
And then, of course, we did go through the time where we even, kind of changed some of the rules to attract more minorities and unrepresented groups, which was a great achievement.
So we had not just nurses, but we had social workers, we had psychologists, we had dentists, we had pharmacists. We began to recognize that health doesn't just belong to health professionals. It belongs to so many other concerned and active leaders in this country that we opened our doors. And that was very consistent with the direction that the Robert Wood Johnson Foundation took.